So now we have to know like who is at risk for this condition. So for every disease or the disorder, there are some risk factors, right? So we should know what are these risk factors. So the first risk factor is the weight of an individual. So if you are overweight or if you are obese, so especially carrying extra weight around the tummy, it is a big factor. So in the same way, the sedentary lifestyle is another factor. And if you're having a family history, it matters a lot. If your parents or siblings have diabetes, or if you had diabetes in the pregnancy, so that is gestational diabetes, your risk is even more higher. And especially in women with PCOS condition, they also have insulin resistance. So now the question arises, how to check? So the simple tests can be fasting blood sugars or HbA1c, so which actually gives us the average blood sugar values over 3 months, or even the glucose tolerance test. So we have made another video on like what are the normal ranges of these various tests. So you can look into that video for more information or clarity. So now the next part is, or the like most repeatedly asked question is, what is the root cause of insulin resistance? So for this, there are several causes or several factors which contribute to insulin resistance. So the first is the excess body fat, especially the abdominal fat, and also sedentary lifestyle. Because whenever there is physical inactivity, it reduces the insulin sensitivity in the body. And also diet. So diet also plays a huge role. Frequent consumption of sugary drinks, sweets, refined carbohydrates, ultra processed foods, snacks, whatever, all this can worsen the insulin resistance. So apart from this, sleep also plays a huge role. So whenever the individual is sleep deprived, so there will be insulin sensitivity, because research shows that inadequate sleep reduces insulin sensitivity. And not only that, chronic stress is also a reason. So whenever there is long-term stress, it increases the cortisol levels, which can negatively affect the glucose metabolism in the body. And another factor is the genetics. So some individuals are genetically more susceptible. So as we have discussed, if the parents or grandparents they have, so they are susceptible to insulin resistance. So we have so far we have known like what is the insulin resistance, what are the risk factors, what are the causes, and how like or the signs and symptoms, or how will you test, right? Now the most important thing is prevention and management. So prevention is always better than cure. And if you are already insulin resistance, then you can manage the condition, because insulin resistance is modifiable. So insulin resistance can often be improved with the right nutrition, regular physical activity, quality sleep, and healthy lifestyle habits. So lifestyle is the cornerstone, and the key strategies are shown to improve insulin sensitivity. So first we shall go with the diet. So you should emphasize on whole unprocessed foods. And you should also consume a diet which is rich in plant-based foods, especially the Mediterranean diet, which is rich in fruits, vegetables, whole grains, legumes, and lean protein. So all these can actually improve insulin response in the body. So always aim for consistent meal times and portion control. So it is very much important to follow the meal timing, proper meal timings. and also the portion controls. Then you have to focus on eating more fiber foods because fiber slows down the glucose absorption and helps to improve blood sugar control. So include colorful fruits and vegetables, whole grains, legumes, seeds. So try to or aim to include vegetables at both dinner and also in the lunch plate. And apart from fiber, you have to prioritize the protein because protein helps to manage hunger and support muscle maintenance. So you have very good options. So we have eggs, fish, chicken, milk, paneer, Greek yogurt, or curd, soya and its products, lentils, beans, nuts, and the list goes on. So you have to prioritize your protein also because it gives a satiety when compared to the carbs and all. And you have to reduce the refined carbohydrates. So I'm not telling you have to avoid or you have to reduce carbohydrates. It is all about the refined carbohydrates. Underline the term refined because complex carbohydrates, they are rich in fiber, so and they're also helpful. So you have to choose whole grains, millets, brown rice, oats, etc. And you have to limit refined sugars like soft drinks, bakery products, white bread, sugary snacks, or packaged desserts. So all these are rich in refined carbohydrates or refined sugars. So you have to avoid them. Then the next important thing is the physical activity. So exercise is one of the most powerful tools for improving insulin sensitivity. So at least 150 minutes of moderate aerobic exercise per week. It can be brisk walking or cycling is recommended. And if possible, muscle strengthening at least twice a week or even 30 minutes of walk after meals can lower the blood sugar spikes. So it is very important that you have to exercise or even simple brisk walking. And the main thing is the consistency and the regularity because exercise helps the cells in our body to use glucose effectively and reduce the belly fat. So if you are having belly fat or if you are overweight or obese, you have to focus on weight loss if it is needed. Okay, for overweight individuals or obese individuals, even losing 5 to 10% of body weight can significantly improve insulin sensitivity. So this can actually reverse insulin resistance in many individuals and even put early type 2 diabetes into remission. So for example, for someone who is weighing around 80 kgs or 90 kgs, so losing just 5 to 10 kgs can make a meaningful difference and have a huge impact. So apart from this, you have to improve your sleep. Actually, the quality of sleep and also the sleep timing. So you have to aim for 7 to 9 hours of quality sleep every night because sleep loss is also linked to worsen the insulin sensitivity.